Welcome to our Let's Talk session. Today's session is titled Head Start and QRIS, Working Together for Quality. I'm Debbie Mathias from the BUILD Initiative and the Director of the QRIS National Learning Network. Before we begin our session together, I'd like to thank the Alliance for Early Success and other generous funders for making this learning community possible. We began this series for state quality administrators and leaders to support their essential work within states around early learning systems building. Quality administrators are welcome to invite other participants as related to the specific topic of the call. We know several of you invited colleagues interested in policy and other cross-sector partners such as Head Start state collaboration directors, education partners, and early intervention providers. We have colleagues on the call from over 30 states and territories. We intentionally keep the session small to invite conversation and sharing. We hope these calls enable us to illuminate challenges, innovation, and promising practice. After the session, a survey will pop up asking for your ideas, suggestions, comments, or questions. And we appreciate your input and ideas about the session, and we'll follow up with resources as requested. Also, thinking ahead, let me know if you're working on a promising practice or facing a challenge in your state systems building. Send me an email, and we can develop a Let's Talk discussion around the topic. Thank you for taking the time to answer the questions when you registered. Many of you provided thoughtful ideas and questions. We've reviewed the information, and it's informing the presentation. Make sure to keep track of your questions and examples during the session for our discussion near the end. Enter your thoughts and ideas into the chat box so we can reference them. We had a great deal of interest in this topic. Head Start, including Early Head Start, is an important partner in state early learning systems building. The families and children served in Head Start move into and out of other state programs such as child care and pre-K. Programs on the ground have been accomplishing combining programs and funding streams, often for many years, serving Head Start families, providing child care, state pre-K, and integrating early intervention services. Understanding and aligning across all the early learning funding streams is essential to supporting a coherent approach within states and providing the most continuity in services for children and families. Our sparks for the discussion today have been working on including Head Start as part of early learning system building, and their stories will demonstrate the opportunities and how they've overcome barriers to their cross-sector approach. This session will not answer all of the questions, but will share the ingenuity and vision emerging across the country in early learning systems building. Without further ado, I'd like to turn the session over to Gina Capito, our moderator. Her background around creating community-based collaborations and deep understanding of Head Start and system building makes her the perfect moderator for our session today. Gina?
Yes. Thanks, Debbie. Welcome, everyone. We really appreciate this opportunity to spend a little time thinking more deeply about Head Start and QRIS and the places where these two important systems for quality align and the natural ways in which we can benefit and leverage one another. So I'm going to just quickly give you an overview of the learning objectives for the webinar as well as kind of the approach that we've built to this afternoon's webinar in order to maximize the opportunity and the content that you're going to receive. As Debbie and Jonathan have both said, we do want you to use the chat feature. So since we do attempt to have pretty interactive webinars when we do work with BUILD, in this instance we might not have as much opportunity for folks to be off mute and raise their questions verbally, so use the chat feature. Debbie and I are watching it. We will integrate the questions in with the speaker that they're most appropriate for, or we'll save them to the end and ask all of the speakers to reflect. So please do put them into the chat. And then also the chat is a record for us, and everything gets captured that's in the chat. So if there's a question that maybe we didn't get to, or it wasn't quite right for this content, but is something that we might be able to follow up with other resources or link you to one of the presenters directly, then we can do some of that follow-up after the fact. So the chat's a great place to put information or thoughts and questions and things that you have. But just quickly, as Debbie kind of gave an overview of what the purpose of the Let's Talk series is, we now are kind of taking that same approach and now applying it to thinking more about QRIS and Head Start participation. Obviously, the timing is ripe for this, with the new performance standards being released in the fall and many programs and states working on aligning with the new performance standards, analyzing what they're currently doing and comparing those to the changes in the performance standards, and then thinking about their timeline for adherence to the different changes. I know a lot of the programs that I've consulted with in the last several months have found that the new performance standards are very easy in many ways to align with, so it's more about thinking about how do they demonstrate the alignment. It's not necessarily a significant change in their practice in many instances. So there seems to be a lot of good things around the new performance standards, but like anything, it's changed, so this is an opportunity to think a little bit about it, and specifically because there is reference made to QRIS participation. So we're going to think a little bit about that and think a little bit about the value of QRIS participation by Head Starts. We're going to understand a little bit more about the perspective of Head Start programs regarding participating in QRIS, which hopefully will support our QRIS state directors in thinking about how they approach this work, especially if you're at the point of whether if you're just newly engaging your Head Start programs, or if you're revising your standards, you've had your QRIS system around for long enough that you're revising standards and you're thinking further about the next phase of engaging with Head Start programs. This is the time to be thinking about the perspective of those programs and kind of how do we work together. And then, of course, along those same lines, we're going to explore some of the approaches to working with Head Starts and achieving their participation within the QRIS system. As far as how we design the webinar, in order to think through and process more of those learning objectives, we really thought that it would be useful to bring in a variety of perspectives to our discussion this afternoon, though I believe it's morning still for folks on the West. So this afternoon, morning. So we wanted to bring in a diversity of perspectives, background, and kind of experience in working in it. So I bring up the speaker slide just so you kind of can see the faces of those of us that you're going to be hearing from throughout the course of the webinar. We're going to start with Cheryl, and I'm going to do a brief introduction for each of the speakers when I'm turning it over to them. But in the sense of how we built the webinar, we wanted to bring in Head Start perspective, particularly pulling from a Head Start program that has been an active leader in their local implementation of the QRIS, and hear a little bit about that angle and that perspective on the work. And then we wanted to move to then thinking about from state systems how they have approached engaging with their Head Start system and the ways in which the paths or ways that they've taken to achieve that, what some of the challenges they've ran into, how they've recoursed or kind of lessons learned have been implemented. And so in doing that, we asked both Helga and Dawn. Helga's with the New York QRIS system, Quality Stars, and then Dawn is with Oregon's QRIS system. So we're going to hear their kind of way that they approached it from a planning perspective as well as implementation, and then also some of the lessons they learned. And then at this point in time that we have right now, where we're thinking about the new performance standards, we're all kind of anticipating how some of those changes in the new performance standards may affect particularly systems that were maybe put into place 2 or 3 years ago on partnering with Head Start, for instance, with changes in monitoring. So we're going to have a little reflection on that and hopefully a little bit of processing about how some of the particular changes in performance standards may impact the different paths that folks have taken to partnering for Head Start participation in the QRIS system. So just a quick thing before we look at the new standard related to Head Start and QRIS. Just wanted to share a slide that's from the Quality Assurance Center, the National Center for Early Childhood Quality Assurance, which is one of the TNTA centers that's funded nationally for both child care and Head Start. A slide that has been shared by staff at the center just highlighting the participation. So this isn't really a new concept, right? The idea of Head Starts and QRIS, and I think Debbie and I both want to acknowledge that we're not, or we don't believe that we're like putting out this new idea that no one's worked on. We understand that many states have worked on this in partnership with their Head Start Collab directors, in partnership with their Head Start Association, the statewide association, as well as the regional entities for Head Start. And so we just wanted to highlight that we've got pretty significant participation of Head Starts in state QRIS systems. For the most part, the participation is, you see the blue section of this pie is that the participation is voluntary. And then there's a small slice of it where it's mandatory. Typically, when it's mandatory, it's usually by funding stream. So if you want to have a better sense of kind of what the mandatory may look like, North Carolina is a good example. They require participation in their QRIS if the program receives state or federal funding. So you can see it's a pretty small percentage of folks that do this, but that's an example of how the mandatory gets played out or how it rolls out in a state, just to give you an idea. And then the little slice, 5% in the kind of olive-colored ND is the section that we don't have data for. That's what the ND is. That just highlights that this isn't new, and so one of the things that we wanted to do was kind of mine some of the good work that's been done on this and process it together and then think about what this means going forward, again, particularly under the umbrella of the new performance standards. So along those lines, I wanted to share with you, just kind of so we're all on the same page with what is in the new Head Start program performance standards regarding QRIS. There is a section, it is underneath the working in community partnerships, in the goal for Head Start programs to be working in coordination with other early childhood and education programs, and I would say also systems within their state and region. And so this is kind of an abbreviated version for folks that performance standards well. You'll know that this is really just kind of the meat of the standard. There's several other layers to it up to find it. So if you're looking for it, it's in 1302.53. If you want to follow it, dive right into the performance standard and find it. But I pulled just kind of the meat of what I think was the most important aspect of this. And the reference there is for Head Start programs to participate in their state or local QRIS, and then there's kind of three criteria, and this is some of what we're exploring, and it's natural that we'd want to be thinking about these types of things, that the QRIS would think about how they could accept Head Start monitoring data to support or document the quality indicators that are required as part of the QRIS, and that's some of course, what we're talking about this afternoon is how do we build upon that, because otherwise we could be pushing a lot of duplication down upon programs if we don't think about how we can use the reporting that Head Start programs are already doing to further demonstrate adherence to standards within the state QRIS. So that's one of the kind of three aspects of participation, is that programs are going to be required to participate if the local QRIS, state or local QRIS, accepts Head Start monitoring data. If participating would not impact their ability to comply with the performance standards, naturally. We don't want, and I think we have a huge number of examples of where participating in the QRIS actually prohibits a program from being able to meet the performance standards. But that's one of the kind of caveats that's been built into the new performance standard. And then if a program is really seeking that participating in their QRIS is not a good fit for them, then they can submit for really what would be considered a waiver by presenting a compelling reason to the Office of Head Start for why they couldn't comply with the requirement. But I think kind of the spirit of which we're thinking about this afternoon is more about how, by working together, QRIS and Head Start in states and local areas can think about ways to make it work versus going down that path of asking for a waiver. I think there's so much alignment between in the delivery of quality and thinking about how systems align and systems work together that there's a natural fit between QRIS and Head Start, and it's about taking the time to kind of to engage in those conversations and build the right systems for the two entities to be working together. And that's, I think, some of the great examples that we're going to hear from with our speakers is how successful they can be in engaging in those conversations. So that is just a quick overview of the performance standard. If you're curious or want more information on performance standards and want to have more, there's a lot of resources through the Office of Head Start to kind of better understanding the implementation of the performance standards and the details of those. We didn't want to focus so much on what's required in the performance standard, is just to highlight that it is in patient in QRIS, and again go with the spirit of how do we work together to make that happen, and what have been some really good examples of ways to make that happen, and what things can we learn from on how to make Head Start and QRIS work well together. So the next thing that we wanted to do then is hear more from the perspective. We thought it would be really nice to start with the perspective of a Head Start program, and Cheryl Hughes was kind enough to join us this afternoon. Cheryl works at WUI Children's Services, which is based in San Francisco and is the largest Head Start and Early Head Start grantee in the city of San Francisco, and does the work through center-based Early Head Start, home visiting, partnerships with family child carers out in the community, kind of has all the spectrum of delivery of Head Start and Early Head Start. So it's a great example of a multimodality Head Start and Early Head Start program. And Cheryl herself is a great example of a Head Start director who has had a lot of deep experience in the program across many years, seen many iterations of quality implementation, quality systems work, the Head Start, thinking about how all the systems align and work together within Head Start, but then brings also the perspective as a local program of then thinking about within the state of California, how is the QRIS being rolled out, what does the pilot look like, and how at the local level in the San Francisco or the Bay Area, how can they support that implementation and bring the Head Start voice to the table in a way that is really meaningful for the whole QRIS implementation in that region, as we being one of the partners that sits as part of the QRIS consortia for the Bay Area. So Cheryl is a great person to speak to us a little bit about Head Start, kind of give us their Head Start's perspective, kind of why participate in QRIS, and kick us off from that angle of thinking about it from on the ground, what this actually looks like and how you can make it happen, and kind of the commitment to why you would want to work together to make it happen as well. So with that, I'm going to turn it over to Cheryl. We're just going to have a brief kind of overview of some of the topics that Cheryl is going to speak on, but we're going to just kind of hear more from Cheryl in a more informal capacity, just sharing some of her thoughts on this. So Cheryl, do we have you there?
I'm here.
Okay, take it away.
Okay. Hi, everyone. I know this is lunchtime for many, and maybe the beginning of your morning and in between meetings, so I want to be succinct and to the point and pragmatic. And I think why we participate in QRIS is just that it's practical, and we're very pragmatic here in Head Start. The whole program aligns with Head Start goals and objectives. I can still hear that feedback. Is that better? I'm turning my phone down. So it's a unifying foundation for us in terms of workforce development, having statewide standards, having data tracking and analysis about who's in the field and how are we doing in terms of developing our own in the pipeline of those who are coming into the program. So the knowledge and competencies and practice of early educators, and bringing our early higher education, our pre-service preparation, our programs into this as well.
I apologize, Cheryl, to interrupt you, but we're getting enough feedback that you are hard to hear. You're a little bit softer than you were earlier.
Okay, how about now? Is that better? Is that better?
Sounds a little fuzzy and a little far away.
Gosh, I'm on the landline, so why don't I try a different phone? You can come back to me?
Yes, we can do that. Yeah. We'll flip. I'll talk a little bit about some of the models for participation, and while you try a different phone, and then we'll go back to the Head Start perspective. How does that sound?
Okay, perfect. Sounds great.
All right. Thank you.
Okay.
Okay. So what we were going to do before I engaged our state leadership that is joining us from New York and Oregon to tell us a little bit about their specific examples of carrying out this work is I just wanted to give high-level overview of some of the models for participation between Head Start in QRIS or Head Start in the QRS system. because we realize that every state QRIS is different and every state context of how these things operate is different. So, what we didn't want with bringing in the great expertise from New York and Oregon is to spend a lot of time trying to understand exactly how their QRIS functions in those individual states, but instead we wanted to kind of get directly into their strategies and how they worked with Head Start and hear that story and hear some of the, hopefully some strategies or techniques that might be replicable in other states or communities, and really get into the meat of that relationship between their QRIS and Head Start. So what we thought would be really useful is to do just a high-level alignment of some of the potential models for participation, and hopefully this will sound similar for folks. These might be strategies that you've used in your state already, so we just wanted to do that at briefest level so that we don't get bogged down in some of that content around, well, what are some of the broadest areas of how we'd approach this? And then when we hear from both Helga and Dawn, I think that we'll hear how they fit within these approaches, how their model maybe is a hybrid of the approaches, or they kind of strictly went with the alignment approach, and it'll all kind of fit then within these standard ways of thinking about it. And so there really are a couple approaches that states use, and we're going to talk about three in particular, and I'm going to give a brief definition of these three and then a couple examples of them before then we hear from Cheryl again, and then hopefully and then hear from our state leadership. They fall into three major categories really, and actually the second and third bullet have a lot of crossed each other, have a lot of similarities, and so we'll talk about that when we get to that. But let's start with alignment. And one of the first things, alignment most at the very basic level is pretty much exactly what it sounds like. It's aligning your QRIS standards with the Head Start program performance standards. And so I've shared a resource here, which I'll talk more about in a second, but what alignment really is focused on doing is avoiding having contradictory or duplicative standards or requests programs. So by taking the opportunity to say, and oftentimes this is done through a crosswalk type approach, by having the QRS standards for a state and then crosswalking them against the Head Start standards, Head Start program performance standards, kind of seeing where are there places where there are gaps and or there are significant differences in how a particular standard can be delivered upon or the requirement of a program, and taking that exercise to kind of align the QRS standards with the Head Start program standards helps then to understand, to make sure that your expectations for programs are comparable and that what they make sense of what you're asking for programs. So it's just taking the opportunity to kind of really understand each entity's standards and how they may differ, or in many cases the instances where they actually are in step with each other, the key part of the alignment process. So the resource that I've shared with you is the National Program Standards tool, which is a crosswalking tool. It has actually many other standards, not just the Head Start program performance standards, but it's a great tool for going through the process of crosswalking without having to start from scratch. And so the tool is actually being, about 4 weeks ago, was being updated with the new Head Start program performance standards. I am not sure if it's the updating has been finished, but it is in the process, if it hasn't been finished yet, of being updated with the new performance standards. And then the desire there is that you can use it to support you in having all of the program performance information in front of you. And so you can go in and choose the areas that you want to crosswalk. Let's say you only wanted to crosswalk with your inclusion standards. You could select that area of the performance standards and pull down the data and then map your state QRIS data against it. So this just highlights that there's resources available to support the crosswalking. But an example, and many states have done this, and in fact I was lucky enough to support the crosswalking effort for the Illinois Accelerate our QRIS system here in Illinois, and through that process really thought about the ways in which our QRS, which I had been involved in a couple of years before, we did the crosswalking with Head Start, the ways in which it was in step and the ways in which it would really make sense for Head Start programs to become rated in our QRS system, because they were clearly already doing a lot of the work and they were already demonstrating that they were doing a lot of the work of the QRS. So in that opportunity, what you're really doing is just kind of making it clear for everyone what the standards are for both center-based and family child care homes, and then putting forward that crosswalk to help programs see themselves within the QRIS as well. And so the example, I also wanted to share another state example, is that Massachusetts has aligned their QRIS standards in this approach, and they did so for both center-based and family child care homes, and thought about those two entities differently within their QRIS system. And this also supports the Head Start programs and providers in thinking about how they'll be able to document compliance or adherence to QRIS standards, because they can see the Head Start performance standards that they're already comfortable with and already familiar with demonstrating their adherence to, see them in relationship to their state QRIS standards. So it's a good exercise, I think, for many audiences to really understand one another as well. So let's look at then the next, which is reciprocity. So kind of the next path that a state might take in thinking about ways to work with the Head Start and the QRIS systems together. And as I mentioned, reciprocity and the alternative pathways have a lot in common and can be very similar, and at times you will see individuals use those terms interchangeably. So at this point I'm going to introduce them as two separate terms, but I think at many times you'll see folks talk about an alternative pathway or an expedited pathway, and reciprocity is all having a lot of similarities in what makes up the work of using this approach. So reciprocity, much like alignment, and within its very definition kind of helps you to think a little bit about what it is, but what we're doing with using reciprocity as approach is offering Head Start programs to receive reciprocity for certain elements of the QRIS because they're already meeting Head Start program performance standards, and that they're in good standing in meeting those, and that they can demonstrate that they're in good standing. That's kind of a point of this that's not on the slide, is that importance of being able to demonstrate that they're in good standing. Same thing for the alternative pathway. And so that's why it's going to get us speaking a little bit to monitoring here in a bit when we talk about the change in the performance standards. So
Gina, this is Deb. One thing that the way I look at it in my mind is, although they don't go through data collection or rating processes, what the QRIS system is acknowledging is that there is another system that is already doing the data collection and rating and process and monitoring processes, right? And so what you're doing in this reciprocity is you're acknowledging the strength of the other system to perform those operations. It's not that you're, quote unquote, letting the program off the hook for anything. They are collecting their data, they're going through a monitoring process in another system, and that reciprocity really shows that you are acknowledging the work in the other system. You know, the same thing can be said, and you'll see many similarities with thinking about pre-K and Head Start, and how are you looking at pre-K or accredited programs within a QRIS. So that's kind of how I saw it in my own mind as a state person working to explain to child care what reciprocity meant. It doesn't mean that Head Start is doing less. It means you're acknowledging another system's role and not duplicating the functionality in that other system.
That's nice, Debbie, to think about, right? Because it is often important to think about the context that some of this occurs in, and that we do have a whole population of child care programs that are attempting to engage in the QRIS system to get their rating, doing a lot of work, and they might perceive that a Head Start program is somehow like hopping the line, right, or that they're not having to do the same work that the child care program is doing. But in fact, they are doing the same work. They're doing it underneath another monitoring entity or for another entity, in this case Head Start, and instead of asking them to do it again for the QRS system, we are acknowledging that work and using the work that they do and being monitored by Head Start and demonstrating adherence through the Head Start system to get them a certain place in the rating structure within
Correct.
So I think that's a nice distinction, especially when we think about kind of how this all looks or feels to other programs that maybe don't understand the Head Start delivery system and don't understand kind of the really strict and comprehensive standards that go with being a Head Start program. That's a good point. And so an example that kind of goes along with what Debbie is raising is a state could determine as far as thinking about reciprocity is that for a Head Start program that's in good standing with adhering to the Head Start performance standards, that they might receive reciprocity within the state QRIS for, say, the family engagement standards portion of the state QRIS, because we know that the Head Start programs have rigorous standards around family and community and parent engagement, and we know that those standards oftentimes kind of are far beyond the standards for family engagement that are built into the state QRIS, and if that's the case, then we're able to use the fact that the program is adhering to those Head Start family engagement standards and is in good standing on that to demonstrate their adherence to the QRIS standards in that area. And that's also an example of the fact that reciprocity doesn't necessarily mean that just by the nature of being a Head Start that they are every single area of you don't have to approach it that way, that every area of the QRIS. You could look at which area, again, kind of thinking about that crosswalk or the alignment process that you probably had to do, is that think about which are the standard areas that make the most sense to offer reciprocity and why, and have some justification for that.
And what's the level of fidelity of the monitoring?
I think that was Cheryl. Cheryl, are you back?
I am back. I'm wondering if this is better.
I can hear Cheryl pretty well.
I think it is better.
Yeah, so that's what I would like to hear from. I'd like to hear from the masses because I don't want it to be just be how I can hear her.
Am I coming through okay for other folks on the call? I said it's muffled.
Yeah.
Gina, do you want to finish up with alternative pathways, and then we'll...
Yeah, and then I'll turn it back to Cheryl, and we'll see how the sound is at that point. Okay, so as I mentioned, alternative pathways has a lot of similarities and components to the reciprocity. Part of it is that a Head Start program may enter into a different level versus starting at the very beginning of the levels of a QRS system. They may enter at, say, a level 3, as the example there is, as opposed to starting at a level 1, but this again is related to being in good standing with Head Start compliance that then demonstrates that they have achieved the criteria required of, let's say say they're entering at a level 3. When we look at level 1 and level 2 within the QRIS, we're able to ascertain that Head Start programs in good standing would have achieved all of the criteria at a level 1 and a level 2, which brings them in at an alternative pathway. And with New York and Oregon, we have some examples also of kind of streamlined portfolios and other ways that support that their components of delivering that alternative pathway approach. And so we're going to hear some great, more specific examples as well from our state folks when we go to that section. But I think if we've got good sound from Cheryl at this point, it'd be nice to hear from Cheryl on the Head Start perspective on this, as what I think Cheryl was just mentioning, kind of hopped in to mention, was about the having good fidelity to the monitoring of Head Start being important as well, to being able to say that we know we have programs that are in good standing and can benefit from some of these approaches to integrating them within QRIS. So let's see how your sound is now, Cheryl. One of the suggestions was that maybe we could just increase your volume a little.
Okay. Is that better?
You were pretty clear there for me. So why don't we give it a try? And you were close to the phone, right?
I'm very close to the phone.
Okay, can't get any closer. Okay.
No.
I know you probably don't need anyone else trying to troubleshoot this technological difficulty, so I apologize. We really want to hear from you, so I'm going to turn it over to hear some of your perspective now.
Well, we've been working with a variation or hybrid of QRIS for some time, starting with the environmental rating scales and then moving from that to class, to coaching, on-site. And I think those are the pieces that I would want to talk about, the practical and pragmatic component of it in terms of unifying the foundations, workforce development, outcomes for children, and family engagement. And from our perspective as Head Start, we've always had to engage with our local, regional, and state level partners and stakeholders in providing the services to children and families. And what QRIS does is give us multiple sources of information about how we're doing and where we might look towards quality improvement. And one example is locally, we're doing research that's a practice partnership where we can get data from all of the programs that are serving children, particularly our most vulnerable children and families. And what are the longitudinal outcomes for children in terms of their school readiness and long-term academic success. So that's exciting for us, and I think participating with QRIS has been a fundamental part of our focusing in on who are those partners that are external that can assist us with being able to present what is the impact that Head Start's having. I think, though, that when you talked about the new performance standards in 1302.53, it starts with family engagement in 1302.50, which is the crux of what we do and how we can influence the QRS, which is what's the consumer education component? Where are families getting information that's accessible to them about quality? What are elements of quality? And I think that Head Start really has a fundamental role in that aspect of the QRS. And the other piece that you spoke about in terms of monitoring, looking at, okay, we have folks coming out to do class assessments, environmental rating scale assessments, delivery of curriculum in particular, infant-toddler focused in our early Head Start. So what's the fidelity of that information and how is it shared meaningfully with the QRS system to not duplicate those fundamental elements? The other piece I would think about are what's in the matrix around the screening and assessment of children, and how do we look at that as we do here from a state, regional, and local level? Are the Head Start early learning outcome frameworks aligned with our infant toddler foundations, for example, for the state of California and the preschool learning foundations? You spoke about the crosswalk. How is that interrelated to the practice in the field? What are people doing with children, and how are we documenting those individualized learning plans to have meaningful outcomes for children that we can speak to across multiple sources of information? I think that's strategically sound and where we're looking to deliver support to our program. I think that Head Start often doesn't address all the different ways in which the program is monitored, evaluated on a federal, local, and regional level that are good data sets to enfold into the QRS. And so it's not just duplication of effort, but also what is the data telling us in terms of where we can focus our attention. So the center-based programs have had a lot of attention on their environment, their teacher-child interactions, best practice. But now there's a focus in our QRS towards family-child care partnership, which is different because these are not our staff, these are our partners. And they come to the QRS or to Early Head Start with an entrepreneurial perspective, a business person perspective. And so for us, we're interested in how do we communicate in a way about QRS and Early Head Start that is value adding to their business and to the outcomes for children and strengthening the relationship with families. And one key element that we are focused on is inclusion, because for many family child care providers, that's an area that they feel most vulnerable in terms of talking with, interacting with, and having meaningful dialogue about individualization for children with families. So we add value by not only training, but we often talk about this, implementation happens at the individual level. So how do we give the coaching and support in the field that it results in better outcomes for children and for families? And then how do we evaluate that to ensure that we are using the feedback that we're gaining to improve our practice? And so those are the elements that I would ask that we consider across the country as essential. the family engagement, is it strong, is it robust, and then how are we evaluating, and what are we using to evaluate the impact of family understanding across variant communities, economic, social, ethnic, that they have real access to what quality means for them, because that's, individualized based on the family's values, their culture, the linguistic understanding of what we're sharing with them, and what's most meaningful for their children. So I think those are elements that we're really excited about, and what Head Start can bring to the table beyond the monitoring and all the different ways in which we collect information is the family engagement that is really robust in Head Start, and a focus on a pipeline of highly skilled, highly competent providers that work with children and families, and particularly those who are most vulnerable. So what's my bottom line? How do we work at a local, regional, as well as state level to create that system of support that's inclusive?
Thanks so much, Cheryl. We appreciate you sticking with it around the audio so that we could hear that full of work.
We are flexible, if nothing else, in early childhood development.
That's right. And that might be one of the lessons of the Head Start and QRIS working together, right, is some of that flexibility and getting to know each other and partnering.
Absolutely.
So kind of continuing with the flexibility, now we're going to hop back, and I'm actually going to introduce Helga from Quality Stars, New York. And I did want to say, and I meant to say at the outset, that Helga has to hop off of the call a little early. So if while you hear Helga speaking, you have specific questions or things that you'd like to know more about with the New York model, go ahead and type them in on the earlier end, so that if we still have some time when Helga finishes her portion, we're able to have her respond to some of the questions. Otherwise, we will certainly follow up with her afterwards to make sure that anyone that has questions for the New York model can get some of their questions answered at that point as well. So before I turn it over to Helga, I just want to do a brief introduction. And as Debbie and I were thinking about speakers for the conference or for the webinar, I don't think that we realized that we ended up with folks, particularly the folks that are in QRIS, that actually have deep, deep experience and knowledge about Head Start as well. And it makes me wonder, both Helga and Dawn fall into that category. And then myself as well, I started in Head Start and have done at least 70% of my career working at some capacity at Head Start. It seems like the folks that are drawn to thinking about working on QRIS and Head Start together are folks that also come from Head Start themselves and have worked across more than one system. So we have a lot of true Head Start folks joining us on the webinar, even though their role now may be with their QRIS implementation system at the state level. And so, as I said, Helga falls into that category as well, working as an infant toddler teacher, working in the early intervention system, working as an early Head Start education manager, and then most recently working as a TNTA manager in her region. So has real experience across many of the levels within the Head Start system. And in fact, when we spoke about the call and prepping for resources that might be useful for all of you joining us as participants, Helga mentioned whether the kind of virtual monitoring resources that are available out on the Head Start website. And that is a link that we can share with folks, but I thought that it might possibly be a little bit overwhelming if you don't come from the Head Start system, but there's comprehensive data available on the Head Start, the eClick website about the monitoring system, at least the monitoring system under the previous performance standards, that really helps folks understand that monitoring that Cheryl was talking about and what that actually looks like within a Head Start program. So there are some great resources out there for that, and as a TNTA manager, obviously Helga knew that well inside and out. So with that, I want to turn it over to Helga, who's the Assistant Director at Quality Stars, New York.
Thank you so much, Gina. I just wanted to explain that I need to cut out early because we're in the middle of our full staff meeting this week. So I agreed to come on to participate with the webinar because like Gina is saying, I came from a Head Start background, and I'm really excited about this opportunity for Head Start to really partake of all of the benefits in a QRIS system, and really committed to bridging this work between Head Start and QRIS. So I'm glad for the opportunity to be on this webinar, but I'm sorry that I do have to leave early for my staff meeting. So I prepared a couple of slides here that kind of describes our process at Quality Stars New York, and I hope to talk about where we have come from in terms of our involvement with Head Start and kind of where we're going moving forward. So just to give you a little context to our QRIS system, we're a voluntary system in New York. Quality Stars is for all regulated or licensed programs. We work with center-based programs, family home providers, and primary schools with pre-kindergarten classrooms. Our system is a point-based system across 4 different categories. We have categories related to learning environment, family engagement, qualifications and experience, and management and leadership. And going through the standards inventory along with an ERS assessment, then a program would then have a star rating. It's a 1 to 5 star rating level, 5 stars denoting highest quality. When Quality Stars was thinking about the types of standards that would go into our standards inventory, I listed here the different sources in which we looked at to inform our standards, and so we definitely have taken it from the licensing regulations, but we also looked at the Head Start program performance standards at the time to inform the types of standards we were building for our QRIS system. We looked at things that NACCE had as accreditation standards, and then we also took some pieces from assessment tools such as the PAS and the ERS. In our design of a QRS system in New York, we've involved the stakeholders from Head Start, specifically the Head Start State Collaboration Director and the New York State Head Start Association, as well as Head Start program directors right in the beginning when New York was moving forward with developing a QRIS. All of the Head Start folks were kind of at the table, and we really relied on their input. With the State Collaboration Director, we took on the task of doing a crosswalk to align the Head Start program performance standards with our Quality Stars New York standards. And in terms of really having Head Start represented in the formation of Quality Stars New York, that really, I think, facilitated a lot of the buy-in from Head Start programs, feeling like that this was a system that represented their needs as well. So currently, we have about 81 Head Start programs participating in Quality Stars. That's about 14% of our total participation pool. We created what we call an abbreviated standards pathway for Head Start programs, and Head Start programs that are in full compliance based on their most recent monitoring reviews would be able to have this fast track through this standards inventory. The abbreviated pathway is also available for NACCE and NAFCC accredited programs as well. In terms of the standards, there are certain standards in which they can earn up to an automatic 149 points. And then there are some, particularly the qualifications and experience category is something that all Head Start programs will still need to work through the items related to that in terms of completing the state registry, and then any non-aligned standards, they would need to submit documentation for that too. And then if they're at the time of provisional rating, if they're a 3-star program or higher, then an independent ERS assessment would be scheduled for them. So when we were thinking about which programs were going to qualify for the abbreviated track, we did think about the full compliance as a measurement. So obviously then if any programs had an area of noncompliance or a deficiency that wasn't resolved at the time that they had enrolled into Quality Stars, we weren't able to give them the abbreviated track. They would have to go through the full standards inventory. Another decision that we made was how to look at delegates for Head Start. So because we know that monitoring happens on the grantee level, and for participation in Quality Stars, we are enrolling programs on a site level. So there wasn't a way to really ensure that the delegates received the full monitoring protocol because monitoring is happening on the grantee level. And so therefore, if a program came in as a delegate of a grantee, then they would need to go through the full standards inventory rather than having the abbreviated track pathway. Another determination that we made was, again, with our decision to kind of look at full compliance measurement, there are some Head Start programs that might have classrooms on a site level that wouldn't be involved with the monitoring, and so therefore, if a program or an agency had classrooms that were not monitored by the Office of Head Start, then those would be the sites or classrooms that would have to go through the full standards inventory for us. And with regards to the abbreviated standards, our philosophy with working with Head Start programs really was similar to Deb's point about acknowledging the strength of the other systems. So knowing that Head Start programs have committed have demonstrated commitment to quality, so we were going to accept their compliance measurement for our quality standards. And what we would collect from programs is exactly that, their report from OHS stating that, that they're a program in full compliance. So I have a slide here that just gives an example of how we did our alignment of our quality standards with the Head Start program performance standards. I'm going to note that this is the former performance standards. So we are currently working on revising our alignment or our crosswalk with the new program performance standards, but this just shows you how we thought about it. So we have a quality stars standard here related to programs implementing developmental screenings for children, and that of course is a Head Start performance standard as well. We note here how it is monitored under Head Start, and so then the points that they would be granted because they already demonstrate that through Head Start monitoring. So thinking about where we're at now moving forward for Quality Stars and Head Start, with the Office of Head Start changing their monitoring system such that they now have monitoring events that span over about 4 years, it is much more difficult now to determine full compliance from year to year for Head Start programs. So there are times where there are pieces of our standards which may not have, a Head Start program may not have experienced that monitoring event related to sections of the standards. So we're still in the works of figuring out how we are going to make that determination of full compliance. Other pieces of determining full compliance that becomes a little, I guess, logistically challenging for us is how we get access to the monitoring results. In Head Start, they have a database system called the Head Start Enterprise System, but it's not as easy to pull up monitoring report results, so we really do rely on programs submitting things to us, and we're trying to streamline some of that kind of submission of documents process if there was a way in which we would be able to have access to the monitoring reports through the Head Start Enterprise System ourselves, then that would kind of alleviate some of the logistical pressures on the program side of things. Another challenge that we're currently facing is this notion that a lot of Head Start programs, because their grants are awarded on an agency level and they operate very much in that fashion on an agency level, but for Quality Stars, we look at participation on a site level. So an agency might have 5 different sites across across different counties in a state. So each site would be considered its own Quality Stars participant and have its own star rating. And for Head Start programs, it really is a shift in thinking that way. So we're trying to kind of figure out how to make that parent-child relationship in terms of the agency across sites really function a little better, and how to do our, sometimes it's even just the nitty-gritty work of the TA involved, how to work with Head Start programs so that they could feel like if their leadership level is really on the agency level, how do we have our specialists work with the leadership involved at the agency level if some of those key decision making doesn't really happen on a site level. So ways in which we're trying to figure out that parent-child relationship within our systems. And then another challenge that we're facing in New York State, we have a lot of Head Start programs, about 240 or so programs to roll in, and these are 240 agencies. And so for participation, we're about there's probably about 1,000 sites we still have to kind of fold into our QRIS. So really thinking about how we're ensuring a balanced representation. We want to support the Head Start programs, but we're also trying to think about how we're supporting the other kind of program settings in our QRIS system. Some things that we have been working on, as I had mentioned before, is the revision of our crosswalk with the new Head Start program performance standards. We also recently launched a new database system for Quality Stars New York. We are using the same platform with our state registry, so it's now an integrated platform, and participation in the state registry is a required feature of our QRIS system. And so having this new database system is something that we really see as kind of an added value for Head Start programs. We know that Head Start programs really have to do a lot of thinking and tracking with respect to kind of targeted professional development and coming up with individual PD plans. And so we're really hoping that they'll see the registry that we've built for the state registry, this kind of system, to be a really useful platform for them. We're also thinking about, within Quality Stars, ways in which we're just aligning statewide initiatives across the whole. So certain things that we know OHS has as initiatives, such as coaching or the pyramid model, these are things we're also trying to support within Quality Stars, and we're having our quality improvement specialists also become familiar with the different coaching models. We had them train in pyramid model modules as well. So ways in which we're trying to think about continuity across all of these early learning systems. So our work really would feel aligned and supportive of what Head Start programs are also trying to achieve. So that's kind of what I have as like a really summary, kind of big picture sharing of what's going on in Quality Stars.
Thanks, Helga. There's a couple things, questions, and I actually think maybe also a little bit of thoughts that were raised in the chat that I wanted to kind of pose to you before you sign off. The one that Nancy Van Bargen, was around the Head Start monitoring report identifying. I know it identifies delegate sites, and I believe it does identify the classrooms that were monitored, and I think maybe what Nancy is getting back to is one of the challenges that you raised about the fact that Head Start operates at an agency level and that the QRIS is focused at a classroom or program level. And I wondered if you had any reflection on that or had thought about how what the monitoring report identifies might be able to be used with that challenge.
So when we have the view of the monitoring report, we have it on the grantee level. So we actually don't have the specific information related to which delegates were part of that monitoring experience or that monitoring event. And we definitely don't know about classrooms either. That is something that I know from my experience in Head Start TA. I know that the federal program specialists could have that information, and when I worked as Head Start TA, I was able to get that information through the federal program specialists. But now on this other side, we have very cursory, very basic information about monitoring results.
Okay. And then the other question I thought I think the answer is no, but I thought you might have the answer to it as a former T&TA manager, is whether or not the Head Start Collab office directors have access to Head Start Enterprise. I think the answer is no, but
they do have access, but it's the same kind of public access, which essentially gives you information that programs input for the program information report. It's the PIR data.
Right.
So really kind of basic, big picture pieces of information.
If the thought there was, and I'm not sure what the thought of the question was, but if the thought there was about accessing individual program information, that's not something that type of access offers.
Right. But those are the kinds of things that I think it does, for us anyway, for me anyway, I will put it out there to Head Start Enterprise System. I am working with the regional program manager for Head Start to kind of talk about what our needs are within our QRIS system and kind of talk about how we can develop places for data sharing.
Right.
I think this is Cheryl again, and I know you're going to hear the feedback, but I think this is where the collaboration, the Head Start Collaborative Office at the state level, working in partnership, could really be valuable.
Definitely.
Any other questions with Helga? Well, thank you so much, Helga, for carving out some time to spend with us this afternoon. I know that it's a big deal to have a week-long organization-wide meeting, so we appreciate you finding some time to change gears and think about this history of work that you've done on Head Start and where you're headed in the next years. As we mentioned before, if folks continue to have questions or additional thoughts that you might want to pose to Helga, we're sharing Helga's email address, and then also don't hesitate to share things in the chat as well, and we will convey those to her. Thank you so much.
Thank you so much.
So then moving on now, we're going to hear a little bit about Oregon's QRIS and their work with Head Start. And our speaker on behalf of Oregon is Dawn Barberis, and Dawn is a program specialist with the Early Learning Division. And as I mentioned upon introducing Helga, we really did end up with quite a roster of folks that have deep experience in Head Start, and Dawn is no exception. Dawn has over 30 years in the field. A big portion of those, before coming to the Early Learning Division, were all in Head Start program, and kind of all aspects of Head Start program, from teacher to home visitor to manager, to working on the implementation of all of the management and operating systems. So deep experience in understanding Head Start is now being brought to Oregon's work of doing QRS and Head Start together. So I'm excited to have Dawn tell us a little bit more of some of the successes and things that the Oregon team has learned and the pieces that they're putting into place. So I'll turn it over to you now, Dawn.
Hi there. Good afternoon, everyone. So as you were just hearing, my name is Dawn Barberis. I work as a program specialist at the Early Learning Division, where I've been since January of 2014, and been working with the Head Start programs in the state and also with our QRIS system. So I'm just going to move right into the slides. So just to give you a real quick overview of Oregon's QRIS system, we actually just began developing our current QRIS in 2013 as part of our Race to the Top Early Learning Challenge grant. Technically, we're still in the field test phase for our QRIS, and we're currently working on a revised system which should launch later this year. Our QRIS system is a tiered system that consists of 5 different domains. There's learning and development, health and safety, family partnerships, personnel qualifications, and finally administration and business practices. Each of the domains have standards, and there are 33 standards in our current QRIS. Each of those standards has indicators at the different star levels, and most of the standards have indicators for each of the 3 different star levels. For each indicator, programs are required to submit 1 or more pieces of evidence showing how they meet the standard. Usually that evidence is in the form of policies, narratives, and in some cases photo evidence. Our system is currently a paper system, and a typical QRIS portfolio that I have seen can fill a 3-inch binder or even larger with all these different pieces of evidence. Oops, I think I just tipped on the wrong thing there. I'm not going to go over everything in this slide, but I just want to put it up here because what this slide demonstrates are all the steps to our current QRIS process for a typical program that's not Head Start. So a typical program would have to be licensed through our Office of Child Care. They need to participate in our state's professional development registry. They need to conduct self-assessment, and they need to develop a quality improvement plan. They work with our quality improvement specialist through the Child Care Resource and Referral System to work on their quality improvement. And finally, some of the steps to enter QRIS would be to submit an application and also a memorandum of understanding that says they understand all the pieces they're getting involved in by participating in QRIS. Then they receive their welcome kit, which is all of the information they need to start assembling their portfolio, and that's when they start pulling together their policies and they're writing up narratives and taking photographs. In addition to all those things, they have to conduct a family survey, and they score that survey and use it for some of the evidence in a few of the domain or a few of the indicators in the portfolio. So the reason I show you this is just so that as I move into this next couple of slides, you'll really see why, you'll kind of appreciate how much we've streamlined our QRIS process for Head Start. So our next slide, if I can find my arrow here. The next slide it shows you how our crosswalk process took place. So what we did is we got together, and the Head Start Region X Technical Assistance Office, with permission from our Region 10 Office of Head Start, was able to get together with some state experts in QRIS, and they went through a process that's much like the slide you just saw from New York, where really the Head Start standards were put side by side with our state QRIS standards. And we went through the whole process. It was actually a little bit before my time in the state, but the state went through that process and found where all the alignment took place. And then once that crosswalk was put together, it was sent to our the Research Institute, which is our organization that oversees our QRIS and supports that QRIS work, and they completed the analysis. Then once we were all done, we sent the information to our Head Start directors through the Head Start Association and let them give us feedback to say whether they thought we had it right. And I was actually on the director side back then, and I remember receiving information and able to take a survey and really give feedback on how we thought that crosswalk addressed the Head Start concerns about whether the value and quality of Head Start would be recognized in the state's QRIS. Then once all that feedback was gathered and a little bit of tweaking, finally the materials and trainings were produced and distributed to the Head Start programs. I should actually go back to that slide for a second. One piece of the crosswalk, there were some things we recognized that Head Start had standards around, things like a lot of health and safety and a lot of information and requirements around personnel qualifications and staff training. But we were also in the midst of doing a lot of systems development in our state, and we were wanting to make sure that our Head Start programs were fully participating in those aspects of our early learning system, both licensing and our professional development registry. So even though the crosswalk showed a lot of alignment between those systems, we did still require Head Start to become licensed, which is the first tier of our QRIS, and also to have their key staff in the classroom and director roles participate in our professional development registry. So when we were all done with the crosswalk, so remember all those domains, 33 standards, evidence at 3 different star levels, indicators I should say, we're talking 100 or more elements to our QRIS that most programs have to give evidence of meeting and complying and showing quality in all those different elements. For Head Start, once we were done with the crosswalk, we ended up with only 9 indicators left that Head Start needed to submit evidence for. 4 of those indicators were related to personnel qualifications, but recently we removed those for reasons I'll discuss briefly in a moment. So now we are left with only 5 indicators that Head Start programs need to produce evidence for, and all of those pieces of evidence are considered to be at the grantee level, which means they only have to submit that evidence once at the grantee level on behalf of all of their sites. 2 of those indicators, LD11 and LD12, that's learning and development 11 and 12 in our standards, are completed through submitting a copy of the program of the grantee's class review report. So really, we're talking about programs being in compliance with Head Start through documentation of Head Start reviews. and then they can show evidence of being in compliance by showing us their class review. So when we're really done with all of that process, programs really just had to show us 3 additional pieces of evidence. One would be in what we call our Health and Safety 6 standard, and that's a screen time policy. And then we have 2 elements of our Administration and Business Practices section. One of them is showing that staff participate in self-evaluation as part of their performance evaluation. And then the last one is showing that staff receive at least 3 benefits as employees. So really, at the end of the day, programs really just have to go through a few steps to become a 5-star program in our QRIS. And those steps are being a licensed site, completing a Head Start QRIS application and a memorandum of understanding, and submitting those few pieces of evidence I just mentioned: a Head Start review letter, a class review letter, a screen time policy, a procedure and form that show how the performance evaluation system works in the program, and finally some evidence of staff receiving benefits. As I mentioned, not everything went completely smoothly, and so our process did evolve. One of the recent changes was deciding to remove the requirement for personnel qualifications evidence from the Head Start portfolio. We did this because we were finding that even though we knew many Head Start staff had higher levels of education and training than was required for our star ratings, and often programs had more staff in the classroom, which improved their staff-to-child ratios, some of our sites were actually failing this section of the rating process due to the ways that we had organized the reports that we used for evidence. So currently we consider all Head Start sites to be meeting the 5-star level in the area of personnel qualifications. We are also continuing to work on smoothing out some other bumps that have been brought to our attention over the past couple of years, including working on streamlining and clarifying some of the licensing process for Head Start programs, and making it easier to participate in the professional development registry and training system, and also working on some other efficiencies and system alignment that we think are going to benefit not just Head Start, but other early learning programs as well. So finally, I'd just like to close by celebrating our success. When we started our QRIS in 2013, fewer than 25% of the Head Start sites in our state were even licensed. So let me say that again. When we started, fewer than 25% of the sites in our state were even licensed. Today, I count that 220 of our 227 federally funded Head Start sites are licensed, which means that 97% of our Head Start sites are licensed in our state. And because of the crosswalk and the engagement of our Head Start programs in the QRIS process, all of these sites either have achieved a 5-star rating or are in the process of applying for the 5-star rating. And I really call that success and a sign that our system is working for Head Start. So that sort of wraps up my piece.
Thanks so much, Dawn. I think that you're right to celebrate when you think about having a system where the Head Start programs weren't required to be licensed, and that's kind of the context that they were the most familiar with and had been operating under, and then to move them from not just thinking about becoming licensed, but also becoming part of the QRIS system and making such huge strides in the few years here that you've been working on it. So congratulations on that. I wonder if I could, while I wait to see if there's other questions for Dawn, I wonder if I could pose one about the registry, and also Helga or Cheryl, if you wanted to jump in on this too. But just thinking a little bit about that kind of the motivation, or how, I'm trying to think of the best way to ask the question, to support Head Start programs, or in thinking about what is the most motivating way for Head Start programs and staff to see the value in becoming part of the registry in the state, and kind of what's, if you have any successes to share around engaging Head Start providers and staff in the registry that might be useful for folks.
Well, one of the early motivators, and it's still a minor motivator, but one of the early motivators is as part of our, I'm sure it was part of our Race to the Top grant. I hope my state colleagues are not rolling their eyes and thinking I have it wrong. But as part of our Race to the Top grant, we actually had funding that was available in our professional development registry system as incentives for participation. So for providers, for staff who are working in licensed programs, they had the opportunity to get a financial incentive for their program first being licensed, and then second, once their program became star rated, they were in line for a second incentive payment for participating in our registry. We still have a minor incentive program for participating in the registry for some of our, for our staff that have the higher qualifications and degrees. Their placement in the registry qualifies them to get $200 once they participate in the registry. So I definitely sort of hold that out as a carrot when I'm enticing programs or encouraging them to participate in the registry. And we also really talk to the Head Start programs about being represented in this state system where all of our early learning providers we're part of the system, and we wanted to have them part of it too, and to show that they were being, good players, and also we wanted their higher levels of education to be recognized in our system. So I think those were a couple of the motivators.
Great, thank you.
This is Deb. One question maybe someone presenting in the chat box is about this notion of the site accountability versus the grantee accountability in the Head Start monitoring system, whereas typically the QRIS is monitoring and the accountability and the rating is at the facility level. And I've seen more and more states grapple with this question, not only for Head Start, but also for multi-site private child care providers. Like which portion of the monitoring could be done at, so to speak, the corporate office or the Head Start, main office, versus what are the elements that need to be monitored and confirmed at the facility level. One of the biggest questions about this is how different states are handling the observational assessments that are part of the QRIS in a number of states, in many states. So how are states handling either whether their tool is the ERS or the CLASS tool? How are you accepting scores from certain facilities but then needing to exert the valid and reliable assessors as part of maybe an every 3-year monitoring approach on sites that haven't received from Head Start the monitoring visit. And I think that we're seeing states be very creative in how they're thinking about it and looking at it. So sometimes there are data needs or desires on the part of the state to get more robust data about the early learning workforce in the state. And so this registry component we were just talking about can be important for states to more strongly understand the whole of the early learning workforce, even beyond the state-funded programs. And I would say people are getting into similar thinking with, what kind of data do we want on across Head Start, NAYC accredited programs, multi-site child care programs, pre-K programs. They can make a common denominator a lot of times by thinking about that observational assessment they're using and saying, we're going to acknowledge the other standards and monitoring, and we're going to apply our observational assessment in each of the facilities under a similar protocol. So it's the same, random check or however they're doing the rest of the QRIS is often employed then. So I'm just bringing that up as a challenge that many states are solving around this monitoring and kind of equitable monitoring. You want to, for streamlining for the facilities as well as cost effectiveness. Look to the other sources of monitoring and accountability. But there's something about what is the, singular point across all the settings that we can look to as a way to understand how each different program funding, what type of quality the different funding sources support, and the quality across the different program funding sources. So I just throw that out. If anybody has worked on that area or thought about that within your state, please feel free to type into the chat box how you've solved that problem or grappled with that. I think the other one that I heard a number of our presenters talk about today was the new monitoring structure and the revised Head Start, and how QRIS or state accountability is going to be able to rely on that type of a monitoring system out of Head Start. And that's probably going to be an area for the feds to think about and look at a little bit more, understanding the state context and what can they then, what will they put forward about the monitoring and accountability of Head Start in that new monitoring system. So I think those two challenges are a couple that I've seen, innovation and people really creatively working on with their Head Start partners within the state about how they're going to work in those areas. Do you know anything that you want to add to those points?
No, I think that you did a nice job of thinking across the speakers, and I think that the monitoring in particular, as we think about, the Head Start programs have been doing this for many, many years and doing the extremely robust monitoring at the rate that we are typically, expected to do under Head Start programs. So I think that there is, even though the standards now are different for monitoring and it is a longer approach to the monitoring, the cycle, I think that there is a lot of potential for thinking about how that gets rolled out and how many of the Head Start programs that are engaging in your QRIS right now have been monitored very recently by the previous system. So they are able to come into your QRIS with that previous monitoring, and then we think about how do we adjust to and build the partnership to reflect what you're going to see from the new monitoring system and how that's going to work with QRIS. So it's not as if the previous monitoring of programs that happened maybe just in the last 12 to 18 months that can still be used at this point in time to support programs and entering into your QRIS system as you work on building a structure that accounts for the new monitoring approach. It's not like everything is lost that came before as we think about the new performance standards.
I'd like to say that we'll be posting a variety of resources along with the webinar on the page where this webinar will be carried. And we do have some resources from the National Center on Early Childhood Quality Assurance that will be posted. And as we continue the discussion, we'll continue to post resources that come to our attention. So if you have some that you've used, please feel free to send them along to me, and we'll be able to post them as resources to others in the field. Are there any other final questions from our participants on the webinar about or advice to share about Head Start and QRIS? Well, I'd like to thank everyone for being a part of the session today, and in particular our presenters and Gina for facilitating and moderating our discussion today. And we look forward to continuing to put out resources and ideas about Head Start and pre-K in QRIS. And those of you that are signed up for our national webinar on Thursday, we will be, one of our products is around pre-K in QRIS. So we're also trying to understand and share information from that angle specifically as well. Thank you all so much, and look forward to our conversations in the future. Goodbye.
Thanks, Debbie.